My name is Dr. Sayeh Lavasani. I'm a breast medical oncologist at City of Hope National Cancer Institute in Duarte, California. I see breast cancer patients only and treat all kinds of breast cancer patients, especially HER2 positive patients. I usually use dose escalation for my patients who are HER2 positive and I need to give them neratinib. I usually start them with 120 milligram of neratinib, which is like three pills of 40 milligram each. And then every week they add 40 milligram to their to their treatment. And in this way, they tolerate this treatment much better. And they only need to take loperamide or Imodium PRN for their diarrhea. They usually by week 5 or 6, they are on full dose, 240 milligram a day, and they tolerate it beautifully. The treatment for HER2 positive breast cancer patients has changed a lot. Now we have more treatment options for our patients. And even though we give them Herceptin or even pertuzumab in neoadjuvant setting, and we have other treatments if our patients, they don't have PCR, still there is unmet need for our patients because we see a lot of our hormone HER2 positive breast cancer patients with metastatic disease. So definitely prevention is the best strategy. And there is definitely a role for neratinib in extended adjuvant setting for our breast cancer patients that after trastuzumab-based adjuvant therapy, we can use neratinib for 1 year to reduce the risk of recurrence for our HER2 positive breast cancer patients who have early stage disease. We usually use a lot of neoadjuvant treatment for our HER2 positive breast cancer patients. And if they have PCR, it's great. But when they don't have PCR, I give them, 1 year of or 14 cycles of TDM1 in adjuvant setting. And after that, I offer them neratinib for as extended adjuvant therapy for their HER2 positive breast cancer to even help them more and reduce the risk of recurrence in future. The criteria that I use for patients, if I want to use neratinib in extended adjuvant therapy, is if for patients who don't have any PCR or for patients who had T2 or N1 disease. These patients are at high risk to have a recurrence in future. We're also worried about developing brain metastases because up to 50% of our HER2 positive patients, they develop brain metastases. And with giving them, with extending their adjuvant treatment with neratinib, we can reduce the risk of recurrence, both outside CNS and also in CNS.